In a major policy shift, China has eased a raft of COVID restrictions aimed at restoring the battered economy. Patients with mild symptoms can now choose to quarantine at home, while negative PCR results will no longer be needed on public transport. Janice Low reports.
Authorities may not openly admit it, but China is finally dropping its zero-COVID policy. The State Council in Beijing has issued a directive on how COVID measures will be optimized. For the first time in 2 years, COVID patients will have the option of isolating at home. Asymptomatic patients or those who experience mild symptoms will now undergo home quarantine for 1 week. Close contacts will need to isolate for 5 days only, down from 8 previously. COVID lockdowns, which had seriously disrupted the economy and supply chains, must be implemented in a more precise manner. Instead of sealing off entire buildings, local authorities can lock down certain levels of a residential block. Mass testing will be conducted at a smaller scale at reduced intervals. Priority arrangements will be implemented to encourage elderly citizens to get jabbed. Less than half of those aged 80 or above have received a booster jab, while only 60% of them are fully vaccinated. Unlike many other countries, inoculation remains voluntary on the mainland. Travelers no longer need to produce a negative PCR result or a health code to get on public transport or enter most public venues. The only exceptions are schools, hospitals, and elderly homes. Authorities would not say if they dialed back the measures only after nationwide protests in the past week.
We believe that they would be able to better cope with the new features of the COVID-19 new situation, as well as based on the mutations of the virus, so that such control would be more scientific and precise and more operational and targeted.
The significant step towards normality came as infections on the mainland continued to decline. But cases remained relatively high, with 25,115 local infections. Janice Low, HKIBC.